Hello, good morning, good afternoon, good evening, where you're watching me from. This is Daniel Delebaratibi, the author of this book, Hope in the Age of Depression: How to Thrive Amidst the Mental Health Challenges, and the founder and managing director of Voice of Restoration. We are based in Arua City, West Nile, 500 kilometers away from Kampala City. We are, for those who are not where West Nile is, we are bordering South Sudan and DRC Congo. That's where we are located, in that part of Uganda where we border South Sudan and DRC Congo. We bring you greetings, and as Voice of Restoration, we offer mental health services. We offer programs around community-based mental health, where we move to different communities. We engage churches, we engage schools, we engage different organizations, talking about issues around mental health. In West Nile region, where we have 12 political districts plus Arua City, making it 13, we engage in the following programs. One, we offer mental health awareness, counseling, and psychosocial support programs. We offer programs on crisis and trauma healing and management, stress management, training and capacity building programs, positive parenting skills, gender based violence prevention, alcohol, drug and substance abuse and addiction rehabilitation programs, relationship and marriage counseling, mindset change programs. We do child protection programs, conflict resolution and management, research and publications, mentorship programs, and financial literacy trainings. Now, when we talk about normally mental health and psychosocial support, many people misquote us, and some people don't actually understand these terms that are used. But in a nutshell, when we talk about mental health and psychosocial support, we are looking at a program that aims to protect or to promote psychosocial well-being and or prevent or treat mental health conditions. Now, one of the things that I want to let us know is mental health problems exists, and most of these mental health breakdowns occur because of psychological problems. And above all, we have still issues around mental health, issues around which impacts us negatively. Some of the peril issues that in mental health that affects each one of us is number one, stigma. Stigma. We talk about impact of COVID. We talk about few champions. We are talking about advanced childhood experiences. We talk about sexual and gender-based violence problems. We're talking about stress. We talk about alcohol, drug, and substance abuse. We talk about the cultures and the customs. We talk about poverty, climate change, separation and divorce, lost levels of mental health literacy within the communities, among others. That's why in the recent years, there has been a growing recognition of the importance of mental health and well-being in communities worldwide. That's why, as organization, as Voice of Restoration, we are aware that mental health issues affect individuals, affects families, workplaces, and entire society, posing significant challenges to social and economic development. So, in response to this, that's where we are able to engage in these issues, helping us know that, hey, help is available. Help is available. And we've seen people recover from mental health challenges. We've seen people recover from whatever conditions they've been through, and they're living fruitful lives. People recover from these issues. And when they recover, they live fruitful lives. That's why we're talking about these issues. That's why we're saying you are not alone. You are not alone. All of us, we go through these problems. That's why we keep engaging these issues. We keep engaging and saying, how do we support? How do we support each other, people? Now, that's why, as an organization, we've been also been able to engage religious leaders. We've been able to engage cultural leaders. We've been able to engage different organizations. Why? Because we want to see how do we support. How do we bring out this? How do we equip with the knowledge. One of the things that I know is the truth is in Africa, depression, suicide, and mental health in general are taboo topics for discussion in every forum. And this mentality has fueled a lot of stigma and discrimination. That's why many people don't seek for help. People don't seek for help because they are stuck to themselves. That's why we're trying to say, hey, help is available. Reach out for help. That's why personally I've been able to document all my stories, my lived experiences. That's why if you check all my books, they are talking about my lived experience. And that's why we're trying to help people realize that all of us will go through problems, but we're able to come out and help one another. Now, to give a background of why we are emphasizing everything around mental health, why our programs are tailored around mental health, why we are doing trainings around mental health, why we are doing engagements in schools, communities such as around mental health, and all that. Now, number one, the truth is we have the rising cases, the rising mental health concerns. We're having increasing rates of mental health disorders, stress, suicide, and drug and substance abuse within communities. And this underscores the urgent need for proactive measures to address these issues at the local level. That's why we're doing community based mental health and psychosocial support programs. Number two, the stigma and discrimination. Stigma surrounding mental illness persists in many communities, leading to barriers to seeking help, discrimination, and social exclusion. Community leaders have the potential, the community has the potential to challenge stigma and promote understanding and acceptance of mental health issues. That's why we're trying to help people know that help is available. Number three, limited access to services, which affects, that's why we are saying, in spite of the availability of mental health services, many individuals face barriers to accessing care, including the geographical, financial, and cultural factors. That's why we are trying to engage communities to see how do we best harness these issues. Of course, the issue of policy and advocacy opportunities, because we try to advocate. That's why we are trying to engage policymakers. That's why we are trying to engage different organizations, different advocacy platforms, so that we're able to advocate for mental health, for collaboration, for the well-being of staff. That's why we're doing workplace mental health. We are doing different organizational programs. Why? Because many of the policies around mental health for now do not support. So that's why we're trying to engage these issues. Finally, leadership and collaboration. We know with effective leadership and collaboration among community stakeholders, driving meaningful change in mental health promotion and support efforts become very easy. That's why we are trying to engage all these issues. Now, what is my call for us this morning, this afternoon, this evening, where you are following me from? One of the things is, now that we understand, when we impact knowledge, when people are aware, when people have the skills and resources necessary to support mental health initiatives within their communities, then things become easy. That's why even the Bible says, my people will perish for lack of knowledge. That's why we want to create more awareness. We want to have effectively address mental health concerns among communities, among people in their families. That's why we also do family mental health, workplace mental health, community mental health. Why? We need to create awareness. I know in some communities, when we people hear about issues around mental illness, our focus goes to witchcraft, our focus goes to different other things. Yet it is a medical condition. Yet it is actually treatable. Yet it can be managed. But people don't seek for help. That explains why we have so many cases now of suicide. We have so many cases of mental breakdowns without any support, without any care. So I want to call upon you who is out there. Maybe you know a family member. Maybe you know a community. Maybe you know a school. Maybe you know an organization. Maybe you know somebody or somewhere you know a community that could be struggling. One with mental health problems. They could be struggling, but even they don't even know that they are struggling. Maybe we can be able to engage and see how to support them. We are always available. That's why our call, even right now, is we need to support our people. We need to see how to support people. That when people are supported, when people are engaged, when people are aware about these concerns, then interventions become easy because we will then know how to support, we then know how to address, we then know how to engage some of these issues. That's why one of the primary areas that we engage in our advocacy programs, in our training programs, in our engagements, one of the things is the overview and the key concepts around mental health and psychosocial support, crisis and the mental health movement framework, community-based psychosocial support, psychological first aid, look at loss and grief, stress and coping, child protection, gender and inclusion, alcohol, drug and substance abuse, counseling skills, case detection and referral, which is very critical, where you are able to know how do you identify somebody with a disorder and where can you engage and where can you refer. Of course, the peer support and self care and community support. Once these issues are addressed, we are able to support our people, we're able to engage our communities, and people are able to seek for help, people are able to seek for services, and above all, we live fruitful lives. I want to bring you testimony here. We have seen people who have recovered from mental illness. Mental illness is not a punishment. Mental illness is not because of any punishment from God. Mental illness, be it depression, be it anxiety disorder, be it bipolar, be it psychosis, be it schizophrenia, be it epilepsy, be it whatever you know as the condition of mental illness, hey, help is available. Treatment is possible. Recovery is possible. I'm a living testimony right here. And many other people who have lived through this and have recovered. So recovery is possible. Treatment is possible. We can all recover from these issues and live fruitful lives. That's my call to us this evening, this morning, this afternoon, wherever you're watching me from. Now, maybe we just need to engage. Our team is available. We have a team of counselors, we have a team of psychologists, we have a team of psychiatric nurses, we have a team of psychiatric doctors, we have a team of people with lived experiences who have recovered. We have a fully fledged team that can answer all your queries, that can help you recover, that can help you walk the journey. Otherwise, we've walked this journey before. That's our call as a voice of restoration. We are here to let you know that help is available, treatment is there, people can recover. Above all, let's support anybody who could be struggling. Because we know in supportive environment, when somebody is supported, they're able to come out clean, they're able to recover faster, they're able to bounce back big. Oh, thank you so much for following this episode. Just in case you are new to this channel and you have not subscribed to this channel, please uh, kindly you can just go down there, click on the subscribe button, click on the like button, and you can also share this with your family and friends. Otherwise, help is available. God bless you.